Well, I think it's easy to see why they've happened. The accelerated rate of vaccination in New South Wales, and in fact in Victoria too, has been unprecedented. With the increased supply and the increased opportunities for people to access vaccines through pharmacies and GPs rather than just the central hubs, we've seen vaccine uptake really accelerate. And so I think when the original roadmap was worked out by the previous Premier, Gladys Berejiklian, and the Chief Health Officer, they had anticipated a vaccine rate that was slower than has actually happened. So I can see why this has happened. We've now got over 87% of people in New South Wales fully vaccinated, which is extraordinary. And so and that wasn't anticipated to happen for another few weeks. So I can see why they brought things forward. And that means that less than 12 in 100 people of adults in New South Wales haven't had two vaccines. And I think that's remarkable, particularly when you see that almost 94% have actually had one vaccine. So if they complete their vaccination schedule, it'll be around about 5 or 6 people in 100 that will remain unvaccinated.
So do you think this decision was based on an assessment of risk, or do you think there's incentive in it too? Because by pushing out that date for the unvaccinated, it creates a situation where they can close that gap faster by just getting vaccinated.
Well, I'm sure there's always other reasons for these decisions, and we can't see inside the minds or the meeting. We can't be a fly on the wall of that meeting. But certainly I think that the freedoms are incentivising to people. There's still likely to be a small number of people who remain unvaccinated, who either haven't been able to access vaccine for a number of reasons, or who are still on the fence. And that small push to thinking about when they can see their friends and family or when they can join in socialising events, that may be all the last bit that will get them over the line to vaccinate. There will always be a small proportion who will have decided, as is their right, not to vaccinate. But the important thing is that for the moment, as we start to unravel all these social restrictions, they can't increase risk for others because they won't be allowed to participate at the moment.
At 95% double dose vaccination in New South Wales, which is obviously what the Premier is aiming for there, what risk do the unvaccinated pose to others and also to themselves? Because we're not going to eliminate COVID, as most experts would say.
Sure. Well, it's important to think about this both at an individual level and a personal level, and also at population level. We're already seeing that vaccination is working incredibly well at population level. We've seen the infection rates really plummet in New South Wales, and the amount of people in hospital has drastically reduced. Certainly at the hospital that I work at, we've closed all the COVID wards. We're just down to the usual ward we'd have anyway now. So we've seen it work at population level. We also know that as the amount of infection in the community shifts, so the risk to each other will also shift. We know at the moment that a vaccinated person is about 10 times less likely to be infected than an unvaccinated. And we know if you meet your unvaccinated friend compared with your vaccinated friend, the vaccinated friend is about 20 times less likely to infect you. So we know vaccine works at a personal level too. And where two vaccinated people meet each other, then the chances of them spreading infection to each other or becoming infected is 200 times less than were it two unvaccinated. So we know there's very real reasons why at personal level this is making a difference as well as population level.
What do you make of the fact that New South Wales really hasn't seen this October rate rise or case rise that we were expecting?
Well, I think some of that comes back to what we originally talked about, Gemma, and that's the incredible rate of vaccination and uptake amongst the general population, the adult population of New South Wales, which was far quicker than we anticipated. And so and we know that the vaccination rate drastically affects the spread of infection. And so we've seen less spread than anticipated because we've seen more vaccination. It's another indication that at population level, this vaccination strategy has really worked. Of course, it's important to note that we've been talking mainly about adults, and there are still small numbers of people in the population that can't be vaccinated because they've got a serious illness at the moment, or it's unsafe for them. And also young children, the 5 to 11-year-olds, still don't have any access to vaccination. So we do have to be mindful that we're protecting them as much as we possibly can too by the way that we relax restrictions, so that we don't see a very big upsurge in infections again.
And finally, 2 new vaccines have been added to the list of acceptable vaccines for people getting into Australia. That's the India and Chinese ones. What about efficacy, and will it matter?
I think all of the vaccinations we've around, particularly those 2, have been shown to be effective. Comparable effectiveness across the vaccines isn't entirely clear because they haven't been compared head to head, but they do show protection. And we have seen, where they've been used in large numbers, we have seen drops in the infection rate at population level too. So they undoubtedly confer protection. And I think anybody that wants to come into Australia, if we are well vaccinated ourselves, the risks, and they are vaccinated too, the risks will be far, far smaller than where we've been to date, where we've had where it's been before we had vaccination.